Hi, welcome back to Educator.com. This is the lesson on the male reproductive system. So if we start with the external genitalia, obviously the penis is a major part of the male external genitals. If we divide it up into a few different parts, the crus is near the base of the penis, and actually, if you look at the Corpora Cavernosa, it's specifically the base of them that's inside of the body cavity. So it's part of the way that the penis is anchored inside the body. And speaking of the word body, the majority of the penis is the body of the penis, which would be all of this region, which of course varies in length. The glans portion of the penis, the glans penis, is also known as the head of the penis, where the urethral opening is going to be found. And of course, through the urethra, you're going to have urine and seminal fluids coming out that contain sperm. The prepuce is also known as the foreskin. So this is the same thing as the word foreskin. In this particular diagram, they don't do a very good job of showing it. I mean, it's not labeled, is what I mean. Here it is. So this outer region here and here, of course, this is a cross section, a sagittal cross section through the penis, but there's some debate as to whether or not the removal of the foreskin is a good or bad thing. Depending on who you ask, I mean, it is a controversial topic. In certain religions, it's removed right after the baby is born, within a few days. Some men elect to do it later on in life. But advantages of getting it removed is that inside of the region between the surface of the glans penis and the inside of the prepuce, you're going to have a material being secreted called smegma, and it is a kind of substance that is nutrients for bacterial growth. Bacteria would be attracted to that, and you're actually more at risk for certain UTIs, urinary tract infections, and the studies have shown that the foreskin there makes you slightly more at risk for certain viral infections, including HIV. But men who have this particular part intact, as long as they keep it cleaned, they can reduce those problems, of course. One of the disadvantages of getting rid of it, from what I've read, is that there is actually a loss of sensation, because you are removing some of the skin associated with the head of the penis or the glans penis, and men who've got it removed after having sex early on in life have reported that there is some reduction in sensation during sexual intercourse. So it's one of those topics that, depending on who you ask, you're going to hear various opinions as to whether or not the removal of that is a good or bad thing. Inside of the body of the penis, you're going to see the Corpora Cavernosa. So one of them is called Corpus Cavernosum, but there's two. And you can't see it very well from this particular angle, but you can see it right here. Here's the Corpora Cavernosa. Corpora Cavernosa. There's actually two. It's like two tubes running side by side. And then underneath them, you would see the one Corpus Spongiosum. So inside of the Corpora Cavernosa, each one has its own artery, and there's a lot of tissue inside of there that will get engorged with blood. Lowering the blood pressure in that artery is going to get increased blood flow inside of sort of this chamber, and that's what leads to an erection. The Corpus Spongiosum is underneath it. You can see that right here. Corpus Spongiosum. Corpus Spongiosum. That's actually, inside of there is where you would see the urethral passageway. And then, of course, there's the scrotum, the sac that holds the testes inside of them. So it's normal to have two testes. Each one is a testis. You also could use the term testicle. But the scrotum, like I mentioned with the female reproductive anatomy lesson, scrotum is analogous to the labia on females. And of course, the testes are analogous to the ovaries. It's normal for the testes to hang outside of the body cavity. And I'll mention more about that in a slide later on in this lesson. It turns out that the inside of the human body, 98.2, 0.6 degrees, whatever it is actually too hot for sperm to develop normally.